Other causes of malabsorption. Chronic pancreatitis and pancreatic insufficiency may occur following repeated acute attacks of pancreatitis, alcohol being the most common culprit, or without any identifiable cause. Steatorrhea develops when less than 10% of pancreatic exocrine function remains. Diagnosis is made by a combination of imaging and dynamic function tests. Treatment is with pancreatic enzyme supplements titrated against response. Whipple's disease. A rare disease caused by Trophirema whipplei that usually occurs in white middle-aged or elderly men. It is characterized by malabsorption, migratory polyarthritis, anemia, and weight loss. Neurological and cardiac involvement may occur, as well as pigmentation and clubbing. Jejunal biopsy shows large foamy macrophages in the lamina propria which contain material positive for periodic acid Schiff, Pa, stain. Treatment is with sulfamethoxazole and trimethoprim for 1 year. Prognosis is good. Tropical sprue. Occurs in residents of the tropics, India, Asia, Central America, but is rare in Africa. It usually follows an acute diarrheal illness. There is persistent bacterial overgrowth in the small bowel, resulting typically in steatorrhea, weight loss, anemia, hypoproteinemia, and glossitis. Small bowel biopsy, jejunal, shows partial villus atrophy and round cell infiltration of the lamina propria. The mortality is 10–20% within months if untreated, but it responds readily to tetracycline 250 mg QDS and folic acid 5 mg TDS. Giardiasis. Caused by the flagellated protozoan Giardia lamblia. It is usually contracted abroad, although it can occur in UK. It has fecal-oral transmission and is characterized by persistent diarrhea after an acute diarrheal episode. Malabsorption is unusual but can occur. Diagnosis is made by finding trophozoites in jejunal aspiration and biopsy. Stool culture is less sensitive. Tinidazole 2 grams as a single dose or metronidazole 800 mg TDS for 3 days is very effective. Hyppolit Asia. Primary hypolactasia is common in most races apart from Northern Europeans. Lactase, a brush border enzyme that breaks lactose into glucose and galactose, disappears after weaning. Subsequent lactose ingestion, milk, causes an osmotic diarrhea. It is diagnosed on clinical grounds or by lactose hydrogen breath test. Secondary hypolactasia can be caused by anything that damages the small bowel mucosa, e.g. viral gastroenteritis, celiac disease, Crohn's disease, and reverses on treatment of the underlying disorder. Short bowel syndrome. Malabsorption occurs when the length of effective small intestine is reduced to less than 100 cm by surgical resection, mesenteric infarction, severe Crohn's disease or radiation injury. Absorptive capacity is overwhelmed and diarrhea and malabsorption ensue. Adaptation occurs, with improvement for up to 2 years. The colon contributes to energy supplies via fermentation of non-absorbed dietary fiber to short-chain fatty acids which are then absorbed. Treatment is difficult and includes dietary modification, attempts to slow intestinal transport and increase absorption, parenteral nutrition, and bowel transplantation in severe cases. Post-gastric surgery. Frank malabsorption following gastric surgery is rare. Iron deficiency is common. The cause is multifactorial and includes hypoacidity, chronic bleeding from friable anastomosis, and decreased intake. Vitamin B12 deficiency may also occur due to lack of intrinsic factor or bacterial overgrowth. Fat malabsorption is caused by an impaired pancreatic response due to bypassing of the duodenum in a bile road 2 gastrectomy, vagal denervation, or rapid gastric emptying preventing optimal mixing with pancreatic juices.